South Africa is described as having an excessive drinking culture. It's actually quite widely known that the majority of South Africans don't actually consume alcohol. About 65 to 70% of South Africans don't touch a drop. The other 30%, though, they drink enough for all of us. South Africans consume at dangerously high levels of alcohol, and this has, of course, severe social, health, and economic concerns. National Treasury is proposing above inflation increases in alcohol excise duties, saying that even a bottle of beer could increase by 20% when it comes to tax, because alcohol-related harm costs South Africa between 10 and 12% of GDP annually. It has a massive economic burden. What would taxation result in fewer people consuming? Dr Chengetai Dare is a senior health economist at PRICELESS SA, a division of the Wits Health Consortium. Good morning, Dr Dare. Really appreciate your time. Does high alcohol prices generally change behavior, or do they simply punish the moderate drinkers?
Oh, thank you for having me, and good morning. So, thank you for raising that question. And the short answer for that is that yes, and it is very clear. There's a strong international and local evidence that has shown that when alcohol becomes more expensive, people drink less and alcohol-related harms decline. So, in this case, price increases reduce binge drinking, especially among young people and heavy drinkers. And you realize that in South Africa, alcohol has become more affordable over time, which has contributed to high consumption. So pricing and excess taxes are among the most effective public health tools available to reduce the harm that is attributed to alcohol consumption.
How strong is the evidence? And we have it from the trauma doctors, those who were in our public hospitals during a COVID period when there were alcohol bans, that we saw a overwhelming decrease in the number of trauma-related crime brought on as about of the consumption of alcohol. What lessons should policymakers take from this? And we take in mind, if you look at the story of the British American Tobacco closing down its only South African cigarette making plant, and this, they largely say, stems from what happened during COVID when there was a ban on smoking. What does the evidence tell us in terms of COVID era bans on consumption or sale, and how it has affected people's behavior?
Thank you. So, if we are to look at local evidence, in particular South Africa, you realize that research has shown that a 1% increase in taxes, actually, or a 10% increase in taxes on tobacco or on alcohol, is actually associated to a 4 to 6% decline in the consumption of alcohol. And this has also been linked to a decline to around 12 to 14% decline in the costs related to alcohol consumption, which in this case is ample evidence that supports taxation on alcohol consumption. And actually, this is also in line with international evidence. If you are to look at, say, Canada, if you are to look at Kenya, if you are to look at Australia, there's ample evidence that has also shown that taxes on alcohol actually has got a positive effect in terms of reducing alcohol consumption and also ultimately costs that are related to alcohol consumption. So if you are to look at the South Africa in particular, you also realize that alcohol consumption in South Africa inflicts massive economic and social costs, estimated to be between 245 billion rands and 280 billion rands annually, which represents 10 to 12% of GDP, which far outweighs the industry contribution in terms of tax. So if we are to look also on the alcohol ban during COVID, you also realize that there was massive relief in terms of economic costs, how also the healthcare facilities were freed from the pressures related to the consumption of alcohol, which in this case it's a testimony in itself.
Yeah,
that
what we also saw during the COVID lockdown was the proliferation then of illicit goods. If it was the cigarette ban, people bought illicit cigarettes. If it was an alcohol ban, the black market sale and also the home brew of alcohol also increased. There has been the alcohol industry saying, well, you increase the taxes, you then see a boom in the illicit market. Do you think there's a legitimate risk, or is this being overstated?
Oh, yes. So the concerns are somehow legitimate, but this concern is often overstated. Evidence has shown that price increase alone, of course, do not automatically drive large numbers of consumers into the illicit market. Illicit alcohol thrives mainly because of weak enforcement and regulatory gaps, together with the poor control of ethanol supply chains, not because legal alcohol is too expensive. So the answer is not to keep alcohol cheap, but to combine pricing reform with stronger enforcement. This cuts across every sector. Even if we are to look, say, at tobacco, the same playbook has been used by the industry. And we have actually seen, and it has been proven beyond any reasonable doubt, that illicit market always thrive because of weak enforcement and poor controls.
So that would mean, while raising the price, would also have to increase the effectiveness of enforcement. And we do know where enforcement is in South Africa, not in a very healthy place. Dr Chengetai Dare, senior health economist at PRICELESS, a division of the Wits Health Consortium. If higher alcohol prices could reduce violence, road deaths, femicide, the burden of the state, but also risk pushing people towards illicit foods, what would you support? Would you support an increase in the taxation of alcoholic products, or is Treasury barking up the wrong tree, targeting the wrong solution?